morning, students. Today I am going to demonstrate you the skull as seen from the anterior aspect or the norma frontalis. Okay, so this is an anterior aspect of the skull which I have drawn just roughly, and I will label it. Okay, while I am teaching you this facial skeleton. Okay, so the anterior aspect of the skull is the skeleton of the face. If you can see it here, this is the skeleton of the face, and the whole thing is called as the norma frontalis, or the anterior view of the skeleton of the face, okay, or the head, skeleton of the head. Now this the anterior aspect of the skeleton of the head, it consists of the various part, okay. Now here is the forehead. The uppermost part is the forehead. Then these two sockets are the orbits. They are called as the orbits, okay, where these eyes are lodged, okay, in the right and the left orbits, okay. Then there is a nasal region. The piriform structure here is the nasal region, that is for the right and left nose, okay. Nostrils, they open here in the anteriorly. Then this is here where I am putting my finger, okay, which is formed by the zygomatic bone here. It is the malar prominence, or the prominence of the cheek, okay. So this is known as the malar prominence, okay. Then comes the skeleton of the upper jaw here, which is formed by the maxillae, and then this is the lower jaw, which is formed by the mandible. So this is the anterior aspect of the skull, okay. Let us come to see the bones which are forming this skeleton, okay, the norma of this frontalis, or the anterior aspect. The bones which are forming it here, they are the frontal bones, in the midline. This is the frontal bone on the top, and it is a single bone, so frontal bone. Then these two plates which are seen here on either side of this median plane, these are the nasal bones, okay, these two plates, right and the left nasal bones. So after the frontal bone, it is the nasal bone. Then on the sides, okay, this bone, okay, which forms the prominence of the cheek, okay, or malar prominence, is called as right and left zygomatic bone, a paired bone, okay, zygomatic bone. Then this on either side of the median plane, which forms the upper jaw also and the side of the nose, these bones are the right and left maxilla, okay, right and left maxilla. And lower down, this is the mandible, which forms the lower jaw. So this is the mandible. Okay, once you have identified the bones which forms the facial skeleton, I will very quickly again review. This is the frontal bone, these two are the nasal bones, then this is the zygomatic bone, this is the maxilla, right and left maxilla, and mandible. Now, these bones, they are united with each other with the help of the joints, which are called as sutural joints, okay. So I will just let you know which are the joints which are uniting these bones. Let us see the frontonasal suture. This is the nasal process of the frontal bone, and this suture here between the nasal plates right and left and the frontal bone is the frontonasal suture. In this diagram, I will label it also, okay. So this is the frontonasal suture. Okay, frontonasal suture, right. Then another suture is the frontomaxillary suture, just by its side, okay. This is the frontal process here, part of the frontal bone, okay, and this is the frontal process of the maxilla, okay, this bone. And when it joins with the frontal bone, so this will be called as frontomaxillary suture. This is the frontomaxillary suture, right. So these are the two sutures, the frontonasal and frontomaxillary suture. Then in between the two nasal plate or nasal bones in midline, this part, this suture, okay, this is called as internasal suture. Internasal, because it is between the two nasal bones, right and left nasal bone, so it is called as internasal suture. Then there is a suture here, this one, which is between the lateral margin of the nasal bone and medial margin of the frontal process of the maxillary bone. I am talking of this suture, okay, with the lateral margin of the nasal bone, and this will be called as the nasomaxillary suture, because it is between nasal bone and maxilla, so it is called as nasomaxillary suture. So these are the suture which are located close to the median plane. Then there is another suture here between the two maxilla, right and left maxilla, which just above the alveolar process in midline suture, okay, and this suture is called as intermaxillary suture. Intermaxillary suture. See here, this suture, intermaxillary suture. I will just put the mandible in proper place and will show you the intermaxillary suture. See this suture here, intermaxillary suture, this suture here between the right and the left maxilla, this suture is the intermaxillary suture. Okay, then there is a suture here. I mean to say, let us come to the suture which are little lateral. This we have covered with that of the which are very close to the midline, okay, very close to the midline. Now this suture here, for example, which is here between maxilla and zygomatic bone, this was maxilla, so this will be called as the zygomatico-maxillary suture. Zygomatico-maxillary suture. Zygomatico-maxillary. I was talking about this suture in the diagram, and this is that suture in the skull which I have shown you here. This is the zygomatico-maxillary suture of the right side and zygomatico-maxillary suture of the left side. Then there is a suture which is called as the frontozygomatic suture. Frontozygomatic suture. This is the frontal bone and this is the zygomatic bone is here. So this suture is the frontozygomatic between zygomatic bone and frontal. We are talking of this suture. See here, this suture. And this is the frontal bone here and this is the zygomatic bone here. They are called as the zygomatic process of frontal and the frontal process of zygomatic, like that. Okay, so these are the sutures which are seen, okay, in the upper part, I mean say, of the facial skeleton, okay, of the facial skeleton. Let us come to the bony features of the anterior, I mean to say, aspect, okay, of the skull or the norma frontalis. Now let us see the bony feature in upper part or in the skeleton of the forehead, okay, and this is because of the totally formed by the frontal bone, okay, frontal bone. In infants there were the two bones, okay, two frontal bones, right and left frontal bone in the infants. They were united with a suture which was going right up to the brachma here, okay, which was anterior fontanelle in the infant, and this suture was known as the frontal suture, okay, but then fusion starts, and by the end of the 6th year and sometime extending up to the 8th year, usually it closes by the 6th year, okay. So there is only a single bone after the age of 6 years without any frontal suture. Sometime a small suture may remain just above this nasal bones, and that is called as the metopic suture. Okay, sometime you may get in some of the skull. That is the metopic suture. Now, What is glabella? Okay, what is glabella and what is nasion? Nasion is a point here, okay? It is a meeting point of intranasal and frontonasal suture, okay? This was the frontonasal suture. This is the frontonasal here. This is the frontonasal suture and this is the intranasal suture. So where these two sutures are meeting and an area enclosing it is called as the nasion. Okay. So I will just draw an area enclosing it here in this diagram and this is the nasion. Okay. This point is called as nasion point. And if you will just feel the above the nasion, there is a depression here. See this in the midline, just above the nasion in the midline, that is the depression, and this depression is called as glabella. It is called as glabella, Glabella. Okay, this point here, this point I will show you. This point just above nasion will be called as glabella. Okay, so this is the glabella point. Now from glabella, if you will trace your finger on either side, if you will see a arch raised margin above the orbit, arch raised margin, and this are called as superciliary arch. This is called on either side. There will be a raised area, arched area, and this is the superciliary arch. Superciliary arch on right side as well as on to the left. They are curved arch shaped structure, mostly in the upper part of the medial part of the orbit. Okay, medial part of the orbit. Okay, and deep to it will lie this, a sinus, frontal air sinus. Now then, see the raised area of the bone. Okay, this is the raised area of the bone on either side, right side and left side. And this raised area of the bone, which will be somewhere here, they are called as frontal amines. As we have seen the parietal amines when we were seeing the view of the skull from the top, norma verticalis, that were the parietal amines. In similar way, above these superciliary arches, okay, in the forehead, these are the bulging called as the frontal amines. Now this completes the feature of the upper part of the facial skeleton. Let us come to the features of the orbit. Okay, I will just keep this mandible aside and will show you the orbit. See, these are the quadrangular areas, okay, openings of the orbit are seen here. Okay, it has the foremargin is supraorbital margin. This is an infraorbital margin. Then there is a lateral margin, and then there is a rounded medial margin. So there are four margins of this orbital opening: supraorbital, infraorbital, lateral, and the medial. Okay. Let us see the supraorbital margin. How it is formed? Supraorbital, which bone is forming? It is completely formed by the frontal bone. Okay. You just feel with your finger this supraorbital margin, and when you are feeling, you can see a notch is present here. Sometime a foramina can be present here. That is called as the supraorbital foramina or notch. Since here in this case it is the notch only on right side as well as left side. Otherwise sometime a foramina can also be there. And it is at the junction of the medial 1/3 with the lateral 2/3 of the supraorbital margin. This gives passage, okay, to the supraorbital nous and vessel. This gives passage. I will just draw it here. Supraorbital nous and vessel, they will pass from here upward towards the forehead. Okay, so these are the branches from the ophthalmic nerve and the vessel. So supraorbital nous and vessel, they pass from the supraorbital notch. Okay, I am not labeling the notch. And just medial to it, and another nerve and vessel will pass, that is called a supratrochlear nerves. They will go and supply the forehead. Okay, soft tissues of the forehead will supplied by space sensory, and they are sensory nerve supply. Right, so let us now trace your finger on the infraorbital margin. Okay, this is formed by which bones? They are formed by the two bones, because there is a presence of a suture here extending to the infraorbital margin. It is the zygomatico-maxillary suture. And thus this infraorbital margin is formed by the two bones, laterally zygomatic bone and medially maxillary bone. So this is the infraorbital margin. This is the maxillary bone, and this is zygomatico-maxillary suture, and in the lateral part it is formed by the zygomatic bone. In the medial part it is formed by the maxilla. So this is the infraorbital margin. Infraorbital. Let us see the lateral margin of the orbit. You can see here the lateral margin. Again there is a suture here, frontozygomatic suture. See here, this suture is here, frontozygomatic suture. Okay, this suture here, frontozygomatic, this suture I am talking. Above is the frontal bone, that is the zygomatic process of frontal bone, and lower it is the frontal process of the zygomatic bone. So this is the frontozygomatic suture, and this is in the lateral margin of the orbit. So the two bones form the lateral margin. Above, a very small region is formed by the frontal bone, while it is a large area or large margin is formed by that of the zygomatic bone. So frontal and zygomatic. Let us come to the medial margin. It is sloping margin, okay, rounded margin, not sharp as supra or infra or lateral margin. Okay, so it is formed by the frontal bone and the maxillary bone. See, this is the maxillary process of the maxillary process of the frontal bone, and the frontal process of the maxillary bone, and these two bones, they form the medial margin of the orbit. Okay, so the frontal bone and the maxillary bone. See here, I will show you here. The above is the frontal bone, and lower down this is the maxillary bone, which will form the medial margin. Okay, medial margin. Okay, so these are the orbital margin. Let us come to the malar prominence and other bony features. And this malar prominence are formed by the zygomatic bone, where it joins with that of the zygomatic process of the maxillary bone, and they form the prominence of the cheek. Okay, malar prominence, or the prominence of the cheek. Okay, and this is that side. This is that side in this diagram. These are the malar prominence. Malar prominence, or the prominence of the cheek. Let us come to the nasal. Okay, after this opening, come to the anterior nasal aperture. You can see here, this is the anterior nasal aperture, which is pyriform in shape. Okay, this is almost pyriform. See here, see, this is a pyriform structure. Okay, anterior nasal aperture, and this anterior nasal aperture is bounded, okay, above by the nasal plates, and lower down it is bounded by this notch of the maxilla. Okay, nasal notch of the maxilla. See, this whole thing is that maxillary bone, and this is nasal notch, where it is having an articulation with the nasal bone. Okay, nasal bone, then this is the maxillary bone, and this is right up to the midline, where there is the presence of the intermaxillary suture. This is whole is the maxilla of this side, and then it is of that opposite side. So this is called as maxillary notch. Okay, so how this nasal aperture, pyriform or triangular nasal aperture is formed, and if in the depth you can see there is a presence of a broken septum, bony septum, the median nasal septum, median, which we will learn when we will go to the nasal cavity proper. And then this is an intermaxillary suture here, just above the alveolar process of the upper jaw, which is formed by the right and left maxillae. Now this upper jaw, okay, has the sockets. Okay, this alveolar process shows the presence of the socket for the maxillary teeth. And at this upper end of the intermaxillary suture, there is a bony projection is seen. Okay, if you can see it here. Let me show you by the side. Okay, side view. This projection, and this projection is called as the nasal spine. This is called as nasal spine. Let us come to the upper jaw. Upper jaw is formed by the maxillary alveolar process. So these are alveolar process of the maxilla. And here in this, the root of the canine is very prominent. See this. This is the root of the canine, and this will raise an area of the bony area will be raised here. This is called as canine amines. Okay, this raised area here. Okay, you can see this raised area which is at the root or the socket for the root of the canine teeth. Okay, and this tooth on right side as well as on left side, they will raise an area called as the canine eminence. And just lateral to this canine eminence, there is a depression that is called as the canine fossa. Okay, if you can remember. Otherwise, it has no significance. Okay, let us come to the lower jaw. Okay, now in the facial skeleton, this is the lowermost part, and this forms the lower jaw. And lower jaw is formed by the mandible, and mandible is the only movable bone in the skull. Only movable bone which is present in the skull is the mandible, which moves at the joint called as the temporomandibular joint. See this at this joint, it is moving at the temporomandibular joint. Okay. Now these are the alveolar process of the mandible. See, these are alveolar process of the mandible is here. And this alveolar process of the mandible will give attachment to the mandibular teeth or the teeth of the lower jaw. Okay, teeth of the lower jaw. Now lower down, this is symphysis manti, because in the infantile age, the right and left mandible they fuse here in the midline. That's why this midline raised area is called as symphysis manti. And here there is a protuberance, triangular raised area. See this triangular raised area, and this triangular raised area in the diagram, this is called as the mantle protuberance. Mantle protuberance. So this is the mantle protuberance. Okay. So there will be a foramina here. See this foramina in the lower jaw. See this foramina. This foramina is called as mantle foramina. This is called as mantle foramina, through which will pass the mantle nerves and vessel supralaterally the direction. So vessels will pass from this mantle foramina. Similarly, there is on this maxilla, there is a foramina here just below the infraorbital margin. This is called as the infraorbital foramina. Infraorbital foramina. And this infraorbital foramina will give passage to that the infraorbital nerves and vessels. And the infraorbital nerves and vessels, they are from the maxillary division. So these are the infraorbital nerves and vessels which will come out through this structure. Now students, you have to still see the attachment of the muscles on the face. Okay, on the face there are plenty of the muscles on right and left facial skeletons which are attached, and they form the muscles of the facial expressions. Okay, and they are muscle which I cannot draw, so many muscles are there, but try to find out the important site of the attachment of the muscle which are called as the buccinator muscle. Okay, the buccinator muscle is attached here on maxilla as well as onto the mandible. Then there is a second muscle which is important to be noted here is the masseter muscle on either side. okay, and the zygomatic bone. So there is a masseter muscle. And third important muscle which you should learn is the orbicularis oculi muscle, okay, which surround the orbital opening present in upper and the lower eyelids. Okay, so these three important muscle you should learn about their attachment in the skeleton of the face, okay, and the skeleton of this completes the anterior aspect of the skull. Okay, I have just told you about the bones forming the anterior aspect of the skull, their joints, okay, between each other. Then I have told you about the bony features and the nerves and vessels passing through the various foramina. Thank you very much for watching this video on the norma frontalis or the anterior aspect of the skull.